Welcome to The Explainer. If you're a medical trainee, you already know that a growth chart isn't just some line on a piece of paper. It's a story. So today, we're going to learn how to read that story by really mastering the fundamentals of measuring growth in children. You know, this quote really frames our entire discussion. We're not just taking measurements here. We are assessing well-being. You have to think of a child's growth pattern as a vital sign, just as critical as their heart rate or blood pressure. A deviation isn't just a number. It's often the very first clue that something needs a closer look. All right, first up, let's talk about your toolkit. You're going to be using growth charts every single day. But here's the thing. Not all charts are created equal. And understanding the difference, well, that's the first step to getting it right. Okay, so a growth reference, it's descriptive. It basically shows you how a population of kids actually grows. The CDC charts are the perfect example of this. They're based on data from a really diverse group of kids in the US. The key thing to get here is that they describe what is, not necessarily what should be. Now compare that to a growth standard. This is prescriptive. It shows you how children should grow under what we'd call ideal circumstances. The WHO charts, that's the prime example. They were made by studying healthy, breastfed infants from all over the globe, so it's a completely different philosophy. So here's how this actually plays out in practice. For the little ones, infants under 2, we're going to use the WHO charts. They're our standard because they model the growth of healthy, breastfed infants. That's our biological ideal. But after age 2, we switch over to the CDC charts because they give us a much better reference for the more varied growth patterns of older kids in the US. So here it is, the simple rule you gotta remember. Under 2, use WHO. 2 and older, use CDC. Seriously, getting this right is the first and probably most critical step to making an accurate assessment. Now let's talk about the language we use, how we describe these measurements. This is all about precision, especially when you're dealing with a kid whose growth is way off from the average. So you'll see percentiles all the time, especially on those CDC charts. But Z-scores, which are kind of the backbone of the WHO charts, give you a much more granular and statistically powerful way to talk about growth. They become incredibly useful at the extremes, when a child is very, very large or very, very small. So imagine this. You plot your patient's measurement, and the computer spits out this Z-score, -3. Okay, but what does that number actually mean for the child sitting right in front of you? And this is the real power of a Z-score. It's like a universal language. It doesn't matter if you're talking about height, weight, or head circumference. A Z-score of -3 means the exact same thing. This is a severe deviation, and it needs your immediate attention. And here are the clinical anchors you need to have in your head. That range between -2 and +2, that's pretty much considered normal. But once a measurement drops below -2, you start using terms like underweight or short stature. And if it's below -3, now you're talking about severe conditions like wasting, which is a really critical loss of weight. Okay, so now we have the right tools and we're speaking the right language. Let's get down to the absolute foundation of all of this, getting a precise, accurate measurement. Because let's be honest, garbage in, garbage out. For kids under 2, we measure what's called recumbent length. And listen, this is a 2-person job, no exceptions. As you can see, one person holds the head nice and snug against the headboard, while the other person gently extends the knees and brings the footboard right up to the infant's heels. We need precision here, down to the nearest 0.1 centimeter. Then, at age 2, we switch to standing height with a stadiometer, and technique is just as critical. The child has to be positioned with their back flat against the board, and you got to check for those 4 points of contact: head, shoulders, buttocks, and heels. Only then do you get the head aligned and bring that headpiece down for a good, accurate reading. And please, whatever you do, do not forget the head circumference. In those first 3 years of life, it is our best clinical proxy for brain growth. A changing trajectory here can be the very first sign of a pretty significant neurological issue. Okay, you've got your super accurate data, you've plotted it on the right chart. Now comes the real clinical work, putting it all together to figure out what the patterns actually mean. For kids over 2, we use body mass index, or BMI, to assess their weight status. You are going to use these CDC classifications constantly. And it's so important to remember these aren't just random numbers. They are defined clinical categories that are going to guide your counseling and your management plans.
All right, now if you remember only one thing from this entire explainer, please make it this. A single point on a chart is just a snapshot, but the rate of growth, the height velocity, that is your most powerful diagnostic tool. And why is that? Because a chronic illness will often slow down the rate of growth long before that child's absolute height ever falls off their percentile curve. It's your earliest possible warning sign.
And here it is. This is the magic number to keep tucked away in your brain. For any child older than 2, a growth rate of less than 4 centimeters per year is a huge red flag. And that number isn't just arbitrary. It's based on solid data. Since over 95% of healthy kids grow faster than 4 centimeters a year, a slower velocity is a statistically significant alert. It tells you that something, whether it's nutritional, hormonal, or something else entirely, might be wrong, and that's your cue to start investigating. And this brings us right back to the beginning. Reinforcing that whole point about velocity, one measurement is just not enough. You absolutely must have serial measurements over time to truly understand what's going on with a child's growth pattern. So from now on, every single time you look at a growth chart, I want you to ask yourself this question. Are you just looking at a single snapshot in time, or by connecting the dots from all the previous visits, are you actually reading the child's unique growth story? Because it's in that story that you're going to find health, and it's in the unexpected plot twists to that story that you'll be the first to find disease.